Well, you know, there is a new wave of optimism among Senate Democrats for health care reform. Party leaders say they're closing in on 60 votes, the magic number to push forward. And they say they can make it happen with some form of the controversial public option. But last week, some Democrats voted against party leaders, pointing to a rising price tag, the same argument that has been coming from the GOP.
I don't think that the vote last week should be any signal to America that we have lost the will to move forward and fix the ridiculously difficult and expensive health care dilemma we face in this country.
So wholly aside from the debate over whether the government gets into the insurance business, the core of the proposal is a bill that the American public clearly does not like.
All right, so the public option suddenly resuscitated here. So let's take this debate away from Washington for a bit and find out who's really on board with this plan. Andrew Rubin is vice president at New York University of Langone Medical Center. Thank you for joining us. Good to see you. You paint a picture of, you can paint a picture of the typical public option supporter here, but you're saying, what I found interesting is that you're saying there's a generation gap between this public option, who wants it and who doesn't want it.
It's important to understand nobody really understands yet how the public option is going to work. But I think first of all, the entire framework for healthcare reform, I think how people view it is generational, no question about that. And the public option would fall into the same category. Clearly, senior citizens are not going to want to see anything changed in their Medicare, benefits, and they're a big voting bloc.
You said what I've read that you said those that are 65 and older, they're against the plan primarily because they believe it will be funded via cuts in Medicare, similar to overall reform issue. Talk to me about that.
Absolutely. Again, Medicare beneficiaries like what they have, and what they're hearing in the news media, what they're reading out, in the newspapers are to fund health care, we're going to have to cut Medicare costs. And nobody really exactly knows what that means yet. So you hear cuts in Medicare, senior citizens hear cuts in Medicare benefits, and they're going to be nervous about their own plan. Now, it's very interesting to point out, a recent ABC News poll, Washington Post poll, came out and said they're softening. But the reason the seniors are softening is because they're actually restricting who would be eligible to participate in a public option.
Okay, let's talk about those a little bit younger, those between 45 to 65 or anyone uninsured. They want the public plan because they are terrified of the current system and recognize there could be big trouble should they lose their jobs, get sick, or have pre-existing conditions.
Absolutely. These are the people who are working today or are unemployed today, and if they're working today, they may be losing their jobs in the near future. And listen, they all know that when they lose their jobs, they'll lose their health care benefits. So they want, and I talk to these people frequently on my radio show, these people want to make sure there's a system in place that protects them to make sure that they don't lose their benefits if they lose their jobs.
Okay, so even younger people, younger Americans who are working, they don't want higher taxes, but they recognize reform is needed. Overwhelmingly, is it younger folks who are on board with a public option here?
It's hard to say what the younger people really want. I've talked to a lot of younger people about health care reform, and they all recognize that we have to do something, but they're also just starting out in their careers, and they don't have a lot of money to spend, and they certainly don't want to pay more in taxes. So they're not exactly sure what they want yet. They know they want to have health care. They know they want to have the option to be able to enroll in health care, but I'm not sure they've yet formed a strong opinion on a public option or not. And again, we're going to have to see what a public option exactly works like. What are the mechanics about it?
Correct me if I'm wrong. You believe that we should do something and fix it and start working along the way. We have to get something done soon because you said Medicare is going to go bankrupt, and it's got to be done.
We have to start, absolutely. We have to get health care reform going. I've said all along, I think there are going to be a lot of mistakes made along the way. Okay. There'll be plenty of opportunity to fix those mistakes once we pass some legislation, because nothing is going to be perfect in this. It's too big.
Once we pass, when do you think? Do you think that something will be passed soon? If so, what does it look like when?
I'm optimistic, and I have to be honest with you. I really didn't think a public option was going to be in the equation. I now see a public option in the equation. I see it in the context of states making the decision, and with limited enrollment to those who can't get health insurance through the private insurers.
All right, Andrew Rubin, vice president of New York University at Langone Medical Center. It's very interesting. I noticed it just from going to tea parties and just doing informal, unscientific polling, and it seems like, what you say makes sense. Younger people were more for the public option and older people don't. Glad you put it in context for us. Thank you.
Happy to be here.
Right.